Danielle Rodin is a board member at UICC, and she's from Canada. She's here to talk to us on cancer and coronavirus risk and safety measures as it affects us. We will currently be expecting Dr. Johnbosco to be with us, and our special guest is Her Excellency Dr. Zainab Shinkafi, CEO Medicaid Cancer Foundation. She's equally a board member at UICC. And I want to use this opportunity to welcome other champions in the house, Project Pink Blue team, volunteers, and our navigators and nurses on board to this occasion. You are highly welcome to the meeting. We appreciate Dr. Danielle's time. We know she has a very tight schedule, but she was still able to create time for us. So you're highly welcome. So I hand over to Gloria. Gloria, are you there?
Gloria, you have to unmute yourself. Gloria, I've just unmuted you. You can talk now.
Yes, I have.
Okay, go ahead.
Hello, good afternoon, everyone. My name is Gloria. I'm Gloria Oku. I'm a breast cancer survivor, and I'm here to co-moderate with our president.
Okay.
Glad to see you all.
Gloria Oji.
Hi, I'm here. Hello.
Hi.
Yeah, my name is Gloria Orji. I am a breast cancer survivor, and I'm the president of Network of, and we are glad to be here, and we've already started. I just hope that other champions will also be on board, because I know that we're going to gain a lot from the lectures we're going to get. So I think we should all sit back and then enjoy the lectures. Thank you. Over to Rancy.
Okay. So Danielle, I have your slide. It's right up now.
Great. So if everybody's ready, I can start. So thanks very much for having me. It's wonderful to get to connect to everyone, and we've been doing a lot of things via Zoom meeting here in Toronto, even locally. So it's nice to be able to use this technology to connect with you in Nigeria as well. I know Rancy from the UICC. We both participated in the Young Leader Program, and he asked me today to speak to you about cancer and coronavirus. And so I'm a radiation oncologist based at Princess Margaret in Toronto, which is a teaching academic hospital. And over the last several weeks, we've been, seems to be all consumed by coronavirus and what we can do to mitigate some of those challenges for our patients and restructure care within the hospital. So I'd be happy to take any of your questions as we go, and so please feel free to interrupt me, and then of course I'll take questions at the end. So Rancy, will you be advancing the slides then?
Exactly, I will. Okay. Yeah.
So coronavirus, you may have only heard about recently, but actually coronaviruses are a large group of viruses that cause many different types of respiratory illness. And actually many of the common colds that we get are caused by a type of coronavirus. And the new coronavirus that's being talked about today is called SARS-CoV-2. And you know, it's very interesting for us because 17 years ago, Toronto was actually the epicenter for the last big SARS epidemic back in 2003. And we had several patients and healthcare workers die from coronavirus at that time. So since that point, we've been learning a lot about coronavirus and how to manage it in our own hospitals. So the terminology can be a bit confusing. So coronaviruses are this large group of viruses, And the one we're talking about now, the specific one, is called SARS-CoV-2. And the illness that SARS-CoV-2 causes is called coronavirus disease 2019, which we know as COVID-19. Next slide, please. So there's been a lot of news around coronavirus, and I'm not entirely sure what's made it to Nigeria, but I thought it would be helpful to just do a bit of a timeline of what's been happening over the last couple of months. So the first case of coronavirus was actually identified in early December in China, and it was on December 31st, 2019 that Chinese health officials informed the World Health Organization about a cluster of 41 patients that had this mysterious pneumonia. And the one thing that connected all of these patients together, was that they all had contact with a wet market, a seafood wholesale market in the same city in Wuhan, China. And by January 13th was the first coronavirus case outside of China reported in Thailand. So, you know, when the virus was initially connected to this seafood market, that proved that there was some transmission between animal to human. And once there started to be more human cases, and particularly cases that had no connection to the seafood market, that's when we realized there was also transmission from person to person. So it didn't take long for the World Health Organization to declare a global public health emergency. And that was by January 30th. And that's when the issues around the virus were really ramping up in China in particular, and in Southeast Asia. There was, you may have read about in the media, this Chinese physician who first raised alarm bells around coronavirus and around these deaths. And he actually died of the disease himself in early February. And by March 11th, as the disease began to spread around the world, the WHO actually declared the outbreak a pandemic. On March 19th, we started to see the effects of some of the Chinese response to coronavirus, where they actually started to have no new locally spread infections for the first time since the pandemic began. But by March 26th, the total confirmed cases in the US reached over 82,000, the highest in the world, surpassing China and surpassing Italy's case count. By the end of March, more than a third of the world was under some form of lockdown. And by April 1st, there were almost 1 million cases of COVID-19, with 656,000 active cases and roughly 46,000 deaths. So I thought I'd just make a few points around coronavirus in Nigeria. Looking at the literature, it seems like the first case of coronavirus was an Italian citizen who flew from Milan to Lagos on February 25th. And he was somebody who, he was an Italian citizen who worked in Lagos, and he had been asymptomatic on arrival. And this was reported, this is an article, I think, from the BBC. And once he presented to medical attention, he tested positive for coronavirus. And many of the cases began to rise within 2 weeks of him arriving in Nigeria. The most recent figures show that there are 232 active cases, 5 deaths, and 33 people who have recovered. This is a slide showing the trends in the total number of cases in Nigeria. And, you know, I think this is actually quite an important graph, because it's showing, if you can see, a steep rise in the number of cases since, you know, we started to see some of those cases. We had your first case really at the end of February, and then we started to see the cases start to rise a couple of weeks after that, and they're still on the way up. 2 caveats of this testing, and this is not just a problem in Nigeria, it's a problem everywhere in the world, is that we've had very little population testing. You may have heard about it in New York, where many people actually don't get tested at all, and so they're just told to stay home and self-isolate. And the challenge is that we don't really have a sense on the total burden in the population. So how is coronavirus spread? Generally spread from person to person through small droplets from the nose or mouth. So we call that sort of a droplet transmission. And you can catch coronavirus, or you can catch COVID-19 by breathing in these droplets, or by touching a surface that the droplets have landed on and then touching your eyes, nose, or your mouth. Next slide, please. Symptoms of coronavirus. So the most common symptoms are a fever, dry cough, and tiredness, and which is a little different from the sort of classic influenza. Aches and pains, a sore throat, and a loss of sense of smell or taste. And this last point has been something that's very unique to COVID and that hasn't been seen in a lot of other illnesses. We don't typically see a loss of smell or taste right from the get-go. And the symptoms tend to start between 2 and 14 days after coming into contact with the virus. And it's actually for that reason that everybody is now talking about this 14-day isolation period. Next slide, please. So what are the concerns with COVID and patients who have cancer or who are cancer survivors? Well, there's really 3 big concerns that have been raised recently, and I'd be interested to know how you're all feeling about it as well. The first is around an increased susceptibility to infection. The next is around fear or anxiety over balancing risk between cancer treatment versus the risk of getting an infection. And fear and anxiety over decreased access to treatment due to resource constraints that are now being redirected and devoted to COVID-19. We're really just starting to learn about the interaction between COVID-19 and cancer, since this is really such a new virus. There's one study that was done in China and that was published just recently. And it's really the best study we have, but actually the numbers are very small. And it's a study of over 1,500 COVID-19 patients in Wuhan, China, and 18 of those had cancer. And they looked at the effect of and the outcomes of the patients who had cancer compared to those who didn't. And you can see on the y-axis, so the vertical axis, this is the probability of having a severe event. And the green line is the probability of having a bad outcome if you have cancer. And the blue line is the probability of having a bad outcome if you do not have cancer. And you can see that the green line is much higher, and that the risk of having a bad outcome, a severe event, if you have cancer, was 39% versus 8% if you did not have cancer. And not shown in this graph, but they also looked at cancer survivors, and that showed somewhere in the middle here. So worse than patients who had never had cancer. Sorry, just go back for 1 second, please, Runcie. The interesting thing about this is also this looks at the time after disease onset, and you can see this is the number of days. It's not, we don't see patients having a bad outcome right at the time that they're diagnosed. It's usually around, a week and a half later where patients start to deteriorate. And that's true for patients who have cancer and those who don't. Next slide, please. So the authors of this study gave 3 recommendations, and this came out actually, over a month ago now. And they gave the 3 recommendations were that we should consider delaying adjuvant chemotherapy, so that's chemotherapy that comes after surgery, or elective surgery, so surgery that can potentially wait, for stable cancer in places where COVID-19 is widespread. They said we should have stronger personal protection provisions for patients with cancer or cancer survivors, and more intensive surveillance or treatment when patients with cancer are infected with SARS-CoV-2, especially in older patients or those with other medical problems. Next slide, please. And so then the question is, are cancer survivors also at increased risk? And, after cancer treatment, our immune systems usually recover over time. So if you're not having just finished chemotherapy, but let's say you finished treatment a year ago, there isn't yet evidence that you're at significantly higher risk. If you're on hormone therapy, that does not affect immune system function. And right now, there isn't evidence that that would put you at increased risk. If you have had cancer in the past, it's unlikely that you're in a vulnerable group for COVID. And by vulnerable group, you may have heard in the news that some people talk about elderly people or those who have a lot of underlying illness as being more vulnerable. And so if you've had cancer in the past, you're not necessarily in a vulnerable group if it's been a long time since you finished treatment, or if you don't have other serious medical illnesses. Many cancer patients and many breast cancer patients are becoming understandably quite concerned about their breast cancer surveillance screening, like mammography, being delayed because of resource constraints and people wanting and physicians wanting patients to stay out of the hospital. And there's the evidence around annual mammograms is actually not that strong, and some would argue that actually having a mammogram every 2 years is not a problem. So right now, the recommendations are that the risk of coming to hospital and traveling and being out in the world and potentially contracting SARS-CoV-2 is more significant than and would be more harmful than delaying a mammogram or clinical exam by a year. Next slide, please. So the big question that all of our patients at the hospital are asking, and I'm sure many patients at your hospitals are asking as well, is, will my cancer treatments continue? And often doctors decide on changes to cancer treatment during COVID based on, one, how cancer treatments are affecting your immune system. Obviously, patients are more at risk of becoming seriously ill from COVID-19 if the immune system is weak after treatment. So if you are on chemotherapy or have just finished chemotherapy, or, as we were talking about, this exposure to the virus during hospital visits. And so many physicians are looking at how to reduce visits to the hospital during treatment. And the final point is there is a challenge now with the impact of the coronavirus outbreak on all health services. There's staff and bed shortages, which are often causing delays in treatment, and it's causing physicians to need to prioritize some treatments over the others. And you've probably heard a lot or seen a lot in the news about flattening the curve. And really what that means is, if you can see the sort of gray line is what will happen if we don't do anything. And then when we flatten it with this black line with the yellow underneath, it's really showing we're not actually necessarily having fewer cases, but it's slowing down how quickly those cases are occurring. And it really has to do with our health system capacity to be able to take care of all those patients. If everyone got sick at the same time, there wouldn't be enough doctors or hospital beds to be able to take care of them. And so people are really trying to minimize the number of people coming into hospitals so that there are more hospital beds and more doctors available to take care of the patients coming through for treatment. Next slide, please. So another question that's often asked is, if I have cancer, what can I do to protect myself? Currently, there's no vaccine to prevent COVID-19 or a specific treatment for it, but there are many that are now being studied. There was an article that made the news here about how when President Trump talked about one of the antiviral or anti-malarial pills, that there were some people in Nigeria who had gone out to buy them and actually had poisoning from overdose of those pills. And I think it's a good reminder for everyone that there are a lot of interesting things that are being studied now that are promising, but until they're proven to be helpful in a clinical trial, it can be quite dangerous to be trying them on their own. And they tend to be tested in patients who are already very sick versus patients who don't yet have the illness. They still say the best way to prevent illness is to avoid being exposed in the first place. So staying home as much as possible, avoiding large social gatherings, avoiding unnecessary person-to-person contact, staying away from crowds. Avoiding touching your eyes, nose, and mouth. I know sometimes as soon as people say don't touch your face, all you want to do is touch your face, but as much as you can to avoid doing that, and to regularly wash your hands with soap and water for at least 20 seconds. Often we all wash our hands, but sometimes don't realize how long and how much you have to scrub to be able to do that properly. And then cleaning and disinfecting things that are being brought into your home frequently as well. Next slide, please. I'm not sure in Nigeria if you've experienced the same kind of quarantining or social isolation that we are subject to here. We are, City of Toronto and actually all of Canada and most of the United States are all under a sort of lockdown where we're all working from home and are not allowed to gather with people outside of our own household. And it can be quite an isolating experience for many people not to be able to connect with people who are their friends or their family. And so there's a lot being done, and particularly for cancer patients who are already somewhat isolated because of their decreased immune function and wanting to protect themselves from infection. This can also be challenging. And so helpful to connect with others. I think groups like this are actually a great way to be able to do that, stay connected even if you're not physically together. There are on Twitter some great breast cancer social media communities that you can be part of from anywhere in the world. I've given an example of one here. You can check out the hashtag BCSM as an example. Also, when we looked at what some of the mental health advice is, some people find it challenging to detach from this 24-hour news cycle, but actually finding that time to reconnect and with other things that you normally enjoy can be helpful. And then, of course, taking care of your own body with whatever ways are helpful to you, whether that's deep breaths, stretching, meditation, eating healthy, exercising. All of those can be ways to help mitigate the isolation that comes from being alone in your own home for weeks on end. So Runcie had asked me to talk about some myths and facts related to coronavirus, and I put a few up here, but if you had other ones that you were wondering about, I'd be happy to answer those as well. One that's common is that SARS-CoV-2 can be transmitted through products manufactured in China. And even though there is evidence that the virus can linger on surfaces for a few hours after contact, the World Health Organization has said it's very unlikely that it will persist on a surface after it's moved and shipped and exposed to different conditions and temperatures. So just because it's come overseas doesn't mean that it will put you at risk. If you can advance, Runcie, please. Another one is that cold weather and snow can kill the coronavirus. If that were true, we definitely would not have any coronavirus in Canada. But the external temperatures and weather don't actually change your human body's normal temperature and don't, unfortunately, kill the coronavirus. Advance, please. Another one is that hot weather makes the virus disappear. And the World Health Organization has come out and said you can catch COVID-19 no matter how sunny or hot the weather is. And so far, evidence shows that the virus that causes COVID-19 can be transmitted anywhere, and that places with hot and humid weather have reported cases. Next slide, please. Another is that the virus can spread through mosquito bites. That right now does not appear to be the case. Next, please advance. Another very common one is that young people are not susceptible to COVID-19. And while it's true that older people and those with pre-existing medical conditions like asthma, diabetes, heart disease are more vulnerable to the illness caused by the new coronavirus, the World Health Organization has come out and said that all people of all ages can contract it, and we've seen that in the number of cases coming through our hospitals here. You know, in Canada, we've seen that there's probably about 15% of our hospitalizations have been in people under the age of 40. Advance, please. And the final one is that wearing a mask will protect against infection. And I put this here because while it's true that masks can be helpful, the challenge is if you wear a mask that is not sort of up to proper standards, or if you're still touching a surface that has been exposed to coronavirus and then touching your face, that will not protect you alone. So, you know, really the best ways for the average person in the population to protect against the virus is frequently wash your hands, covering your cough with your elbow, not your hand, and keeping a distance of at least 2 meters from others who are coughing and sneezing. And if you are at least 2 meters away from other people, then you won't have the same requirement around wearing a mask at all times. So that was a bit of an overview, rapid overview of coronavirus in general and as it relates to some of the decisions we make in cancer treatment. Thought now I could just open it up to see if people have questions. Happy to try to answer.
Okay. Gloria.
Okay. Can you hear me now?
We can hear you, yes.
Okay. Okay. Thank you very much, Danielle, for that presentation. So I have some questions here. Although I've been trying to see it to remove the point you already touched so that we don't keep on going around and around the same thing. Okay. The first question here is, how dangerous is coronavirus to a cancer patient?
So, you know, it's a virus that is so new that we're still learning about it, but it really has to do with whether you currently have cancer, and there's a big distinction between whether you currently have cancer and are undergoing treatment versus whether you're a patient who has completely recovered from cancer. And the evidence shows, and that study out of China that I showed demonstrates that if you get coronavirus or if you get COVID-19, as a cancer patient, you are more at risk of having a bad outcome than if you don't have cancer. And so, you know, this is news that is still evolving, but right now we feel that the risk is actually quite high amongst patients who have their immune system compromised because of treatment.
Okay, thank you. And another question, is there a relationship between cancer and COVID-19?
Do you mean, is there a relationship between having cancer and getting COVID-19?
Yes, I think that's what the question is all about.
So when your immune system is lower, you are more likely to get an infection. Now that can be true of any type of disease that lowers your immune system function, not just cancer. So there isn't something about cancer that makes you more likely to get COVID-19, except for the fact that when you're on treatment, your immune system doesn't work as well as it normally does. And you know, that's why we also see that patients who are older, who don't have as much reserve as younger patients, are also at higher risk.
Okay, thank you. And another question, is COVID-19 airborne?
So great question. All the evidence right now, and this is actually confusing for a lot of people. So generally right now, we believe that COVID-19 is transmitted through droplets, not through airborne. However, there are some procedures that can make those droplets more airborne. Those procedures tend to be done in the hospital. So let's say a person needs to be intubated or go into the ICU or have their airway managed or go through surgery. It is possible that the procedures being done can make the virus more airborne. And in those cases, you would need, and the doctors performing them need special type of masks to protect themselves. But for the average interaction, it is just seen as droplet. There are some studies that are coming out that are showing it's possible for these droplets to be airborne, but that is really that doesn't necessarily mean that it can be, the virus can still be transmitted in the air. And, you know, I think the feeling is that if it were truly airborne, we would have seen even more rapid spread within hospitals than we've seen already.
Okay, thank you. And another question just came in. And the question is, can COVID-19 trigger cancer lumps?
No.
Okay. Thank you.
Okay.
And
you have one more. Gloria, you have one question from Dorothy.
okay, is it on the group?
Yeah, it's on the WhatsApp, it's on the chat.
Okay, okay, let me check very quickly.
I can take it for you if you don't mind.
Okay, please do. Thank you.
Okay, so this is a question from Officer Dorothy, and she said, what can we take or do to improve our immune system at this point as cancer patients?
So, you know, I think that the best thing really that can be done to protect yourself around COVID is actually staying away, and all those social isolation and social distancing that you can do. It can be very hard to boost your immune system when you're undergoing treatment. I'll talk about a few things that you can do, but the safest thing that can be done to protect yourself right now is actually staying away from crowds, staying home as much as possible, staying away from anyone who has symptoms. Sometimes when you're on chemotherapy treatment, your doctor can give certain types of medication that increase your white blood cell count, and that can be used to fight infection. The other thing that can be done is, I think, you know, reducing stress, eating healthy, sleeping well. I know these seem like motherhood statements, but actually those things can all be helpful to put yourself in the best position possible should you get sick.
Okay, I think we can take two more additional questions, which could be the last two questions. Then we can move to the next speaker. Gloria, do you want to take up these two other questions that just came in?
Yes, and somebody asked, how bad is the outcomes for a cancer patient? Meaning someone with a compromised immunity, is COVID-19 an automatic death sentence for someone with a compromised immunity?
So it's definitely not an automatic death sentence, but it often means that you are more at risk of having a severe infection. And again, really what we know about this comes from that study in China, where when they looked at patients who had COVID-19 without cancer and those who had COVID-19 with cancer, there was about a 30% increase in bad outcomes amongst the cancer patients. So that doesn't mean that everyone has a bad outcome. Many people recover at home or recover after hospital support, but it does mean you're at higher risk.
Okay.
And someone is asking on the vaccines, because there's been a lot of talks about vaccine and drugs here. So someone is asking if there is any vaccine, or if there's none, how close are we to getting a vaccine for COVID-19?
Yeah, it's a great question. And there's a lot of research being done all around the world that's trying to come up with a vaccine. But the reality is that it takes actually quite a long time to develop a vaccine. And even after it's developed, it then needs to be tested in the population to make sure it's safe before it's deployed for an entire population. And so, you know, I think we're many, many months away. Probably realistically, it would be next year, but for sure, many months away from having a vaccine. And
Okay.
I'll just quickly answer that holding your breath for 20 seconds does not prove you don't have the virus.
Okay.
Okay. I think I may just have to jump in to ask this last question because we need to move to the next speaker quickly. But please feel free to still drop your questions. We're going to take it up and we're still going to send it all to Danielle, and she's going to be gracious enough to still respond to your questions. So feel free to still send it. But let me ask this last question. We have just 2 minutes to move to the next presentation. The question says, what is the connection between 5G technology and cancer and COVID-19?
I think the main connection between 5G technology is that it may allow us to connect better during the time of COVID-19 amongst cancer patients. I can't speak of any other direct link. Maybe Ransi, you have some other thoughts on that.
Okay. Thank you very much. Samson, you've heard the response from Danielle. We will move to the next speaker. Gloria, please, can you do that, please? Gloria, can you introduce our next speaker? I can do that if that's okay by you.
Okay. Is it me?
Is it my Gloria? No, we are there, two of us.
It's Gloria Oji.
Okay.
It's Gloria Oji. Okay, it looks like Gloria Oji. Gloria Oji, are you in? Okay, maybe I can help to do that. Is that okay by you? Okay, so before I introduce the next speaker, I just wanted to let everyone know that we're so delighted to have our special guest of honor in this meeting, an amazing woman who has been a very strong advocate and speaking for all cancer patients, not just in Nigeria, but across Africa. She's been our mentor. She's been of great support to the work we do in Nigeria. She's the founder and executive director and CEO of Medicaid Cancer Foundation. Her Excellency Dr. Zainab Shinkafi Bagud, she's in the house. Yeah. I don't know if Her Excellency want to say anything.
Hi, hello everyone. Okay. Can you hear me?
We can hear you, Your Excellency.
Okay, great work, well done. Great talk, Danielle. Very interesting. I'll say something at the end. Let's go on. These things can take a long time.
Okay, thank you very much, Your Excellency.
Yeah.
Okay, so I'm so delighted to introduce our next speaker, who, in the name of Dr. Johnbosco Chukwuorji. Johnbosco Chikwa is a clinical psychologist, and he is actually also a lecturer. He spent several years of his life working in the area of health psychology, providing support in the area of depression, in the area of anxiety, in the area of death and dying, as well as he is currently a Fulbright visiting researcher at Cleverland State University, United States. He's also the public relations officer of the Nigerian Psychological Association. We're really happy to welcome Dr. Johnbosco, who is going to speak on how cancer patients can apply some psychological coping strategies to support them at this moment. Thank you very much.
Hello, champions. Hello, champions. It's my pleasure to.
Yeah, sorry, everyone is on mute. That's
today.
why you can't hear them respond. But yeah, for live.
Okay. It's my pleasure to be with you today and to interact with you. My presentation is an interactive session, so to speak, but I'm not sure of the number of participants we have. So as we go on, feel free to make your questions known, and at the end, we are going to be taking note of them. The presentation I'm going to make today is Coronavirus and Cancer, Psychological Coping Strategies for People Impacted by Cancer. And I am glad that Dr. Danielle has made her presentation, because in the course of the presentation, you will note the some issues she raised about anxiety, about depression, and about fear, which is a common occurrence on issues that surrounds the COVID-19. And borrowing from that too, and from the study that was conducted in China on cancer and COVID-19, one thing that some of us have noted in evaluation of that study is that even though people living with cancer or cancer survivors may be increased risks, they did not into consideration controlling for certain factors like age, other mental health or psychological or physical health conditions that may have in one way or the other impacted on the risks that these individuals had. So, but it's still something that we find significant in the sense that the study is an effort. So today I'm going to be talking about the meaning of fear, the meaning of anxiety, and the meaning of depression. And we are now going to later on look at certain practical steps that one can take in trying to cope with these mental health conditions, or generally the side challenges surrounding COVID-19. And at the end, we are going to do a brief meditation exercise that we believe may be very helpful in coping with the COVID-19 and how it may impact you as an individual. We can begin to look at the issues of anxiety from this perspective. If, for example, that one comes in contact with a dog, and this is an individual that usually has a dislike for dogs, or maybe dreads dogs, what the individual may experience in that situation is the feeling of fear. So in such situation, you say that the individual has the fear of dogs. But if someone has been told that a dog is going to be coming here, maybe in about an hour, and this individual experiences some sense of worry, nervousness, unease, and certain feelings of restlessness about the imminent danger of a dog being there, such a person is said to have anxiety. So the difference between fear and anxiety is that in fear, the object of fear is there. It is present, it is there. But an anxiety is an uneasiness or concern about a future consequence or occurrence, that which has not become present, that which one cannot see or feel at the moment. And going down to depression, depression is an affective disorder. It is a disorder associated with feeling. The dominant symptom of depression is that low mood that an individual feels. But apart from this low mood, there are also other symptoms associated with depression, most of which may be physiological. For example, an individual may have disturbed appetite, where a person eats more or eats less. So it is not only that you don't have appetite for food and then you say you are depressed. No, it can also be where an individual eats more than the person usually would have been eating previously. And the same applies to sleep. When a person sleeps either less or more, it can also be that depression is there. And you have loss of energy or fatigue, loss of interest in usual activities, those involvements or engagements that you usually would have been willing and happy and eager to do, staying away from them is also something that shows some feelings of depression. And loss of concentration too. The loss of ability to be able to concentrate in what you are doing, and feelings of worthlessness. So in general, the issues surrounding feelings that we usually talk about in depression is that sense of life being meaningless, the self being worthless, and the future being hopeless. When these three issues of meaninglessness, worthlessness, and hopelessness come in to the fore and present themselves, then depression should be looked at. But it is not something that you say, okay, maybe when somebody begins to have one or two of these symptoms, you say the person is depressed. No, it has to be diagnosed because a lot of other factors will need to be considered. But you begin to look towards this direction, and then when other factors are considered, you can make a diagnosis of depression. Depression and anxiety are two important mental health issues that worsen physical health conditions, and that is why they become relevant in the case of cancer. And in this era of COVID-19, one principal issue that most of people, cancer champions and those living with cancer may experience from the questions that you have noted in Dr. Danielle's presentation is health anxiety. And in its simplest form, health anxiety is when bodily sensations are interpreted as being ill, for example, or when one begins to have this sense of worry, nervousness, or unease about a health situation. And in these cases, it may mean that the individual may avoid going to hospital even when it is necessary because the person feels he or she is going to come in contact with the coronavirus disease, even when the person's regular visits or routine visits have been scheduled to take place. The person doesn't have to do that. Or it may also come from the angle of somebody now beginning to stockpile things like hand sanitizers, like masks, and then other food items, because the person feels that sense of danger and then
How
needs to
does
take some of
depression
these
affect libido?
actions.
I'm asking on behalf of young girls who may have cancer.
Okay, we are going to address that too. And in these situations, they are all pointing towards this direction that there is this unnecessary concern the person may have about the coronavirus. I just got a question and maybe we address it before we move on in terms of how depression may affect an individual's libido. We've already pointed out that even though this depression is a disorder of affect, it also has some physiological substrates. And without meaning to sound too technical, there are certain body functions that are correlated with a depressed mood or a depressed state. And some of those body functions may have to, things that have to do with, apart from we've mentioned issues of loss of appetite and sleep, the loss of interest in usual activities, which were pointed out, is one particular area where we see its association with a sexual interest or sexual activities. Sexual interest or sexual intercourse is a normal activity which is approved for individuals that are within the right relationships or within the age bracket where they should do it. And where an individual begins to notice that even without any form of physiological disorder, that is, any form of something being wrong in his or her body, his desire or her desire or for taking or engaging in sexual intercourse have become so low. And it is not that there is any medical condition that influences it. It is a time that one may begin to consider looking at depression as a factor that explains that loss of interest. So in our normal everyday life, we all face situations of anxiety, especially. And this anxiety is something that is good for us. It prepares us for action. So if you ask me, I will say that anxiety is normal. But what is wrong is when this anxiety becomes disabling, when it becomes debilitating, such that it, instead of pushing us to action, it impairs our ability to take the right actions at the right time. And that is when we see it as a disorder in psychological terms, and attention should be given to be able to control and manage the anxiety. So we are going to consider some practical steps that one may take in being able to cope with COVID-19. And the practical steps I have adopted in this presentation is the one that was developed by Dr. Ross Harris. He is a psychotherapist and renowned doctor. And when this pandemic emerged, he has developed some steps that will be able to be helpful. And the acronym for these steps is called FACE COVID. FACE is F-A-C-E, and then COVID, C-O-V-I-D. So the first letter there, F, which is the first one we are going to be talking about, means focus on what is in your control. In a lot of things in life are within our control, but still there are other things that in life that are outside our control as human beings. In this our situation where COVID-19 stares us in the face, there are a lot of things we can't have under our control. For example, the economy, the state of the economy of the world, or in the Nigerian economy. You can't do anything about it as an individual. The virus itself that is existing currently in the world, you can't do anything to be able to control the virus and how it is growing as a person. You can only control how this virus influences you, or the extent to which you can get the virus. You can't control the weather. Even though some individuals, though Dr. Danielle has corrected it, some individuals believe hot weather will make the virus disappear. Or as a study in China has shown that when the weather gets too hot, it rather limits the rate at which the virus spreads. So some people may be praying in Nigeria that, oh, let the weather continue to increase. You can't do anything about it as an individual. And then you can also not control the future. So we ask ourselves, how long are we going to be in this lockdown? It is not under your control to determine that. But there are things that are within your control as a person. Taking these right actions, as have been outlined earlier, they are within your control as a person. That is what you should focus on. Then A is acknowledge your thoughts and feelings. What is the greatest problem we have as human beings in our daily lives is that a lot of people usually have this disconnect about their thoughts and feelings and who they are. Sometimes you hear people say, I don't even know how I'm feeling. So the individual that does not know how he or she is feeling there is a disconnect between him or her, within him or her. So the person lacks this self-understanding. And because of this lack of understanding, the person may have this difficulty in being able to acknowledge his or her thoughts and feelings. So if you are feeling anxious, you should be able to know it. If you are feeling unhappy, if you are feeling sad, if you are feeling in high spirits, you should be able to know it. Then that takes us to the third one, which is the C. And this C means come back into your body. Coming back into your body, another way that I can put it is connecting with your body. Some of us may, even though it's something that we think it's immaterial, are you able to realize that you are breathing and to know that you are breathing? A simple way of even talking about this is for you to just clench your fist as we are talking. Are you able to feel that touch of your hands, of your fingers? If you have that feeling, then it's a simple way of making you to be able to come back into your body. Understanding your body itself is this third step. And then the fourth is the E. And the E means engage in what you are doing. Engaging in what you are doing is this sense of reality that we should be able to have. when we're talking about depression, we talked of a loss of concentration, absent-mindedness. Coming into your body, engaging in what you are doing means if you are doing a particular thing, it means that your mind and your actions are pushing towards that particular action, and not a situation whereby, for example, you are in a particular place, but your mind wanders off to other places. Then the C, which starts that other part, COVID, is committed actions. The World Health Organization has stipulated some guidelines, and Dr. Danielle has presented them earlier. These guidelines, we must, as individuals, be committed to them. And committing to them also implies that we should also transmit it to others. We should teach it to others, inculcate it to others, in our family members, and those that are around us, for them to be able to follow these actions to the letter. It also implies taking small positive actions. And I am particularly happy about this particular program which we are doing today. It is part of taking those small positive actions that make big difference. Committed actions implies being able to take some, push towards some goals that will be able to help to save our world from this pandemic that we are facing. And O means opening up. Opening up means, in other words, we can talk about it as self-disclosure. Attend to your needs as an individual. You are human. Love yourself. And because you are human, it means you have your strengths and weaknesses. Recognize those strengths and weaknesses. And do not see your weaknesses as being so much of the biggest, greatest flaws. As much as you make effort to be able to conquer these weaknesses and to be able to overgrow them, you still realize that these weaknesses are there because you are human. And these weaknesses are easier to manage when, as a person, you raise it up to the right persons that should be able to know them. So that in relating with you, they already know these weaknesses and they interact with you from that perspective. And V means values. The way I look at values in its simplest terms is that which is important in life. So in life, it is not everything that is important. And what may be my own value may not be your own value. But what are your own core values, that which pushes you to take actions at every point in time? In a lot of ways, there are ways that your values can impact on COVID-19 and its outcomes. Values like values of love, respect, patience, courage. How are you as an individual, can you as an individual see that you apply and implement these values to stand for something towards COVID-19? And then I means identify resources. Even though we live in a limited setting, in some resource limited setting, especially in Nigeria, where a lot of things may be lacking, there are still resources that are there and abound around us. Resources like health workers, even with the several other things that may not be there. Resources like mental health practitioners that you can talk to. Resources like religion, for example. And I am particularly interested in issues of religion because sometimes we look at religion as things that is just about going to church or going to a mosque. No, religion is a life itself that is lived. And so even there, with the restrictions that no one should attend public religious worship, religion is something that you can practice on your own. That interior sense of your innermost self and realization of a power beyond you as a person. Connect with it within this time, beyond just going to church and praying or going to the mosque to pray. Then D is disinfect and distance. This particular one becomes important to us in this particular era where we talk of social distancing. No, the right thing for us in psychology is physical distancing, which is you make effort as much as possible to always stay beyond, not more than, not, it should be at least 6 feet away from people. But even when we are physically distanced, we are encouraging, as psychologists, people to be able to socially connect. And one action in terms of this social connection is this activity we are doing. And there are also, with social media being readily available in recent times, you can still connect to people in several ways using social media and be able to help them. Maybe sometimes we'll put it this way: how many persons have you as a person reached out to today to know how they are doing? A lot of times in life, we look at it that it is only people that should ask us about us. No, you should also, as a person, make out to reach out to others, to make them feel appreciated, to know how well they are coping with the challenges that we are facing in this, at this present time. And so, before we do our brief meditation exercise, there is this particular statement, quotation by Reinhard Niebuhr, the American theologian, and he stated it this way: grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. We are going to be doing a brief mindfulness meditation exercise. It's not going to last more than 5 minutes. And so I will encourage you to sit comfortably. If you are sitting there, regardless of the position where you are at the moment, you do not need to change your position, but just make sure you are comfortable where you are. If you are sitting, you can rest on the chair, place your arms on your laps. You may also decide if you want to close your eyes, and just ensure you are in a very comfortable position. So we begin. Begin to focus attention on your breathing. Feeling your chest moved gently, inward and outward. Your mind may be racing with uncontrollable fearful thoughts. That's okay. Just continue to breathe naturally and effortlessly. Feel the air as you take it in and out of your nostrils. Feel the soothing lightness all through your body, from the top of your head all the way down to the tips of your toe, gently and effortlessly. As you slowly and gradually create this awareness, repeat after me, either loudly or in your mind, each time counting down from 5 to 1. You may either say it out or you say it in your mind. 5. Stillness, awareness. 2. Stillness, awareness. 1. Stillness, awareness. Remember, you are not these unpleasant feelings. You have overcome them in the past, and you rise again, ever changing. If the feelings stay with you for some time, it is okay. Time and awareness will allow it to fade. Time and awareness will allow it to fade. And now, one last time, counting from 5 to 1. Repeat after me. 5, stillness, awareness.
Awareness.
4, yes, awareness.
Awareness. Stillness. Awareness.
Stillness, awareness.
Stillness. Awareness.
1, stillness, awareness. Do you know the distance from one of your ears to the other? From your nostrils to your mouth? From one eye to the other? Stay with your feelings, whatever they are at this time, for just a few moments. Feel the air moving slowly in and out. And your chest move out slowly, gently, and effortlessly. You are becoming aware. Peace will return. Remain in stillness and allow yourself to let go. Thank you.
Wow. Thank you very much, Johnbosco. This is really amazing. We greatly appreciate it. So I don't know if is Gloria here? Do we have Gloria? Gloria, do you want to pick up the question and answer?
Yes. Although, hello, can you hear me?
Yeah, we can hear you perfectly.
Yes, we can.
Okay, but you've taken off my video.
Sorry, I'm going to put it back right away. I just put it up. I put it off at some point. I'm going to. Yeah. Okay. Your video is back now.
Okay. Okay, and most of the questions we still have are still related, not directly to what Dr. Johnbosco has taught us. So do I still ask the questions?
Yes, I think you should ask it. If it's something he can respond to, fine.
Okay.
If he cannot respond to it, then it's something we can send to Danielle.
Okay. So somebody asked if hand sanitizers are healthy for cancer patients. Hand sanitizers.
That should be for Dr. Danielle.
Yeah, I think so. Yeah. So we're going to send that off to her.
Okay. And somebody also asked on drugs, cancer drugs, and COVID-19. Is it possible for COVID-19 drugs to impact on cancer drugs? So assuming a cancer patient comes down with COVID,
I think that's
and has to take COVID-19 drugs, does it have a direct impact on the cancer drug?
I can make a response to it.
Okay.
Generally, in medical care, the medical practitioners are not just going to administer drugs on patients without knowing their pre-existing medical conditions. And that is why self-medication is highly frowned at. It is not something that should be encouraged by anyone. So when someone is receiving treatment for cancer, or maybe somebody has a history of cancer and is already a champion, and the person contracts the COVID-19. And one of the things, even if medical practitioners don't ask, is to let these people taking care of you in the hospitals or in isolation centers, to let them know that you have a cancer history or you are under treatment for cancer. With that information, they are going to know the right medications that they are going to give you to prevent complications. So it becomes much relevant if it's something like an illness where one can go and then you buy a drug for yourself. No. With the right medical advice, they will know what to do.
Okay, thank you very much. And there's this question on how to manage the depressing effects of certain cancer drugs. So some cancer drugs are quite depressing. I noticed that during my own treatment. So is there anything we can do to manage such effects?
Yes, there are steps you can take as an individual, and that is in depression self-management. One is for you to, I'm happy that there is that awareness, which means that the individual knows what is going on. It is already the first step towards managing it. You are aware that you are depressed and that the depression is due to this drug you are taking.
Yeah.
So with that realization, you already know it is something that will pass away when the use of the drug is stopped. Then the other thing you can also do is to be able to seek help. And this seeking help may mean professional help, or it may also mean just reaching out to others. Talking to someone about it is a step towards finding a solution. So if you have medical practitioners, like we have a very challenging situation in our Nigerian situation where you don't see much of the mental health workers working together with the medical practitioners in treating cancer patients, and it's a challenge. But even without that, you can still talk to your medical practitioners that, oh, I am feeling depressed and I think I may need to talk to someone. Where they need to make referral, they are going to link you up with medical experts that may come. Then two is that it's not just only the mental health workers, especially if they are not there in the hospital where or receiving care. They are not the only ones that you can talk to. You can, because one major factor that complicates depression for people who have depression is when those around them do not understand what they are going through. So your behavior may change when you are depressed and your caregiver misunderstands it. But if you've talked to your caregiver, oh, I am having these feelings of low mood and strange feelings. And if it is someone that is enlightened and knows what depression is, you may call it the name. I think I'm getting depressed. So that the person knows what you are passing through and then either helps you to find help or understands that some of your behaviors may not be because you just decided to be difficult. And with that, with those steps, you can go a long way in recovering.
Oh, thank you very much. And please, could you suggest some other physical activities that a cancer patient can do to manage depression and anxiety? Physical activities, anyone that would be good for us. Taking into
in recent times. Okay, thank you. In the COVID situation, it's difficult for some of us to suggest much of physical activities, especially those ones that you can do with other people being around. But one physical activity that one problem I may not be sure of, maybe the current situation in Nigeria at the moment, but one thing that may impact on people's health is at this current situation is sedentary lifestyle. Because you're at home and you don't go to work and maybe your business, you are no longer going there. A lot of people may have this problem of sitting down for long. And you may just be sitting down watching films or listening to the news. One way of being active, even while you sit down and listen to the news and watch the news, is for you to maybe stand up in your living room and move around as you are listening to the news. And the benefit of sitting down, standing up when or moving around when you are listening to the news is that with the several stories of doom and gloom that we see on the media, if you are active walking around while listening to it, it tends to reduce its impact on you as a person. Then it's also important that where you can, and with the right medical advice that suits your situation, you can also have some physical exercises or fitness exercises that you can do in your home. But this must be done in with the advice of the medical practitioner so that you don't bring about some complications that will negatively affect your health. And I believe that, and then apart from that too, is I also encourage people to take walks even when there is COVID-19. No one is saying that people shouldn't come out. What we are saying is that you should be able to physically distance yourself from others. And so when you come out of your house, and the streets usually I would expect are less crowded these times. Yeah. So it doesn't mean that if you are passing and then somebody passes you by, that means you are breaking social distance. No. So if you are taking a walk along your streets, it may enables you to be able to take in some fresh air. And then it also enables you to be able to see things that you wouldn't see when you are inside. And that exposure you get outside will have mood elevating effects on you as a person. Because what is usually difficult is in moments of depression, in moments of anxiety, is this inability of the individual to be able to initiate the action, the right actions. So you may have a desire to go out, but you feel too weak to go out. But when you conquer that, you are able to conquer that limitation, and you stand up and then take a walk out. On coming back, you surely have some relief.
Okay, thank you very much. I don't have any more questions with me, except if Ronsi has some.
Okay.
Hello.
Yes, thank you very much. Let me quickly, I'm just checking the chat now. I don't have any question, but I have, yeah, I think that's no question. Is our meeting chair still online?
Hello?
Yes. Okay. Hello, Ma.
Hello, I'm online. Can you hear me?
We can hear you, yeah.
Okay,
yeah,
I'm on.
Okay, good. So I think we don't have any other question. Maybe you
sorry,
can...
do you mind if I drop a question? I'm really sorry for interrupting.
Please go ahead. It's okay.
Right.
Okay, so I'm Farida Mohammed. I am a research gastroenterologist. So I've been doing a little research, and with regards to what Dr. Danielle said this evening about the cancer treatment in patients with COVID-19, I just have one question. If a cancer patient comes in with symptoms that are attributed to COVID-19 and they tested positive, what therapeutic measure do they take? Do they stop the cancer treatment and focus on containing the virus, or do they neglect the virus and continue the chemotherapeutic treatment or target therapy or whatever? Because when you have cancer already, you have a suppressed immune system. Now, when you have both cancer and COVID-19, is a whole different ballgame. What exactly do they take as their first step to handling this problem?
Wow. Farida?
Yeah?
That is God. This kind of question you ask now, who will now answer you? Is it me?
I think I can say something about it.
Okay, thank you very much, Doc. Thank you.
Yes. Treatment decisions are not usually made by patients alone. Treatment decisions are made by medical practitioners with the consent of the patient. So when one's medical history or situation is reviewed, and it is noticed that this individual is undergoing treatment for cancer and has got infected with COVID-19, it is the medical practitioner's responsibility to weigh the options and give the right advice to the patients on the line of action to take. And the normal appropriate line of action is usually to be able to have a priority at any point in time. Knowing that a combination of the chemotherapy or other forms of treatment may impair the immune system of the person, one may have to, at least in the interim, give way to the other. So they are usually, it's most likely that they are going to face the one where imminent danger, that portends imminent danger, and conclude the treatment for that one, or at least manage it to a reasonable extent before they take the next action to treat the other ailment. It's unclear. Research has not shown us in the right times whether it's possible to properly carry out both treatments at the same time. What World Health Organizations and some other organizations are advising people undergoing treatment for cancer to do is that the outbreak of COVID-19 should not disconnect them from their regular treatments. They should still make effort as much as possible to connect with their caregivers, that is the professional caregivers, and continue to receive their care as much as possible. And where even the routine visits, where it is not possible to have physical visits, you can also have virtual visits by way of telehealth services and continue to receive your care. That is what we are being encouraged. But in terms of whether there should be concurrent treatments, there is no concrete recommendations as regards that, but I believe individual cases will be reviewed and they will make the right decisions.
All right, thank you very much.
I don't think we have any more questions. Do we have any more questions? There is none on the chats, and I don't have any more questions left for you. So over to Ronsi. Hi, Ronsi.
Hello, Ronsi.
Yeah, sure, Ronsi is there. Hello.
Hello, Ronsi, are you there?
Ronsi, unmute yourself, please. Unmute yourself.
I'm sorry, can you hear me now?
Yes, we can.
I'm sorry. So I was just thanking Farida for that brilliant question, and thanks, Doc, for responding to it. Ordinary, if I was just here alone, you would have given me high blood pressure because I don't know anything about that question. I always stay on my lane. Everybody that knows me know I like to stay on my lane. What I don't know, I'll tell you, no, I don't. Thanks, Doc, for responding, and thanks for the wonderful presentation. I will pass it on to our meeting chair. We have a message from Her Excellency Dr. Zainab. I don't know if the meeting chair can just read that instead of passing over to her, and we can consider our social. Ma, can you see the message she sent, or should I read it from my end?
Hello, Ronsi.
Yes, ma, we can hear you.
Okay, you can read it. I'm not seeing it.
Okay. Okay, so she just said that most people get sustenance on daily basis in Nigeria. You know, even WHO is messaging and informing us about physical distancing. So there is a lot of controversy around religion, around going to church, going to mosque. And she also said that recently there is also some information around stopping cancer treatment in government hospitals. This might not be a bad idea until we are sure, of how the curve of COVID-19 is taken in Nigeria. It seems that it might not be severe in Nigeria, unlike as COVID-19 have been severe in many countries. We don't know why it hasn't been severe, but we're happy that it is not, that it's just the case slightly is lower, So she also continued to say that, we have issues about not having ventilation, not having, that all the patients so far, that there are very few patients that have had ventilation. So that these are the reasons why cancer patients need to avoid public places and stay clean and stay home. He said we must all know that we are vulnerable. That is the core message. Because of that vulnerability of all cancer patients, please, every cancer patient, we don't want to hear any bad story. Every cancer patient to stay safe, avoid people from visiting your house. Just stay with your own house, your family, stay with people that you've been with and that you know their movement and their history. Thank you very much, Your Excellency, for this wonderful message. I think she has to jump out quickly, so she just dropped the message for everyone. Yeah. So I'll leave it up to our chair. But before then, after our chair finished speaking, just to let everyone know, if I have your permission, we want to take a group photograph. Okay, so let me allow our chair go in now, then we can move to social.
Okay. Dr. Johnbosco, we want to really appreciate you for creating time to be with us. We really appreciate the way you handle this matter for us. We look forward to seeing you as time goes on more of our meetings. And at the same time, we want to appreciate Dr. Danielle for creating time to be with us. And in absentia, Her Excellency too, for the information. The information Ronsi just read to us now, it's quite and highly, very, very paramount to each and every one of us that has these underlying health issues. And I hope that we'll all be able to stay safe and stay where we ought to stay so as to minimize our exposure to the virus. And I want to use this opportunity again to appreciate every other champion in the house, our Project Team Blue Team members, people from ACT Foundation, we need to appreciate them. Medic Aid, we appreciate you for the support. And we look forward to seeing you participating in our subsequent meeting. Thank you all for coming. And it's a pleasure that we did this. We hope to do better next time. Network isn't faithful to us, but we hope to overcome it as we go on. Thanks so much to everybody. You're highly welcome.
Okay, so maybe we can have Her Excellency, the President of the support group, to deliver a short goodwill message, and then we can then take the group photograph, and then I can unmute everybody. Then we can have our social, we can have a chat. Everybody can talk at that time. Greet, Swat, Gimba, Sarah to Hadiza, everybody you can then chat. But let me allow Her Excellency to just say something briefly. She has been eating her tool.
Oh, actually, it's not product we're on.
Okay. I think Okay, I think Her Excellency is slightly frozen. We can't hear her. Yeah. Her Excellency is I mean Gloria Oji, our governor. She's slightly frozen, so we can't hear her. So I want us to please. Do I have your permission to take the group photo? The group photo we're going to take is taking a screenshot of all of us.
Yes.
If that's okay. I can just do that. So you can turn on your video, please.
Okay.
I can also help you turn on your videos. Just turn on your video so we can see, then I can just take a photograph.
I'm not to that place, so you can't see me.
If you don't want that, you don't have to turn it on.
Where's my shadow?
Okay, and I will share the video with everyone. I'll share the picture.
Yeah, shit, I'm seeing my stuff now.
Please, somebody should help me on this line. B-boy.
Oh, need to smile, you need to smile.
We should smile.
You should raise your hand.
Okay, so.
1, 2, go ahead. Okay, very much. I've just done that. Please, before we leave, very important person in the group, and for us to do. In a few minutes, say something to us. We have leader. Please from the joining us all the way from.
Rosa, I can't hear you.
Okay, Lee, can you hear me? Lee, if you can hear me, you can talk now.
I can hear you. It's wonderful to be with everybody today. I'm in New York City.
So Lee, tell us a little bit about you. What do you do? Tell us about yourself.
Yeah, so Runcie and I met. We were fellows at the NIH NCI Cancer Prevention Fellowship Program in Bethesda, Maryland. I am in New York. I work at New York Presbyterian Columbia University Medical Center, and I am in integrative oncology, so cancer prevention, and I work with cancer patients to help them devise programs to help with side effects from chemotherapy and radiation.
Fantastic.
So it's really great connecting with all of you.
Thank you. Yeah. One thing leading about herself is that she's an award-winning yoga expert.
Wow.
Yeah, so thank you all so much. The meeting is just going to end now, but I'm going to unmute everyone, and then we have the next 30 minutes to catch up, say some greetings to everyone, just chat, and you know, all the microphones are now on, so everybody you can talk.
This more right for me. Now I tell you, right about the first one. Then I'm
Thank you.
Swati.
Yeah, what's up?
Hey, Swati, it's good to see you.
Hello, everyone. I'm missing everyone.
Okay.
Diane.
Hadiza, how are you?
I'm fine.
Hi, Diane. Are you missing me?
Ronsi, well done. You're doing a good job.
Thank you. Thank you.
Hope to see you back home soon.
Thank you. Thank you all so much. Really, really. And thanks to Medicaid. Thanks to every one of you for making our time to join us. It's so amazing.
We're always happy to be a part of what you're doing.
Francis, did you take my picture?
Yeah.
Okay. Ronsi, you
All right,
still have your
Ronsi,
Nigerian
thank you so much
accent.
for having me. I must say it was resourceful having all of this information, and I can take my leave now.
Thank
You
you so
all
much,
stay
Ma.
safe and stay home.
Thank you.
God bless you all.
Bye.
Bye.
Thank you. Yeah, so I just wanted to say, I forgot to mention this. We are thinking of having this meeting again. So we're thinking of having this meeting. Maybe we're going to focus on nutrition and cancer. Because we've been having so many questions around what to eat and what not to eat.
Yes.
Look at, nutrition around cancer. So, but we haven't got a speaker yet, but we were trying to, in every of our meeting, we always want to be having a mixture of a Nigerian and, a foreigner, or maybe, just to have a mixture so that I can have a good balance. So we haven't got a speaker yet, but once I confirm, I have a friend in Ireland she's a nutritionist. I'll reach out to her. Yeah, Lee, you know her, right? Yeah, she's a nutritionist. So we're going to reach out to her, and if she's available to really give us some talk on nutrition and cancer, we'll definitely reach out to you all and let you know what the date is. Swat, how are you doing?
I'm doing great, Ronsi. What's up? Hi,
Fine.
buddies.
We're fine. Swat, look at how you are shining. Yes. Yeah, we really thank you for everyone. Thanks for everyone for coming.
Thank you so much for this meeting.
Welcome.
Yeah, thank you so much for organizing.
Gloria, your video, your internet went off at some point.
Ronsi, may I know if Lee is still in the house?
Oh, Lee, yeah, Lee is still in the house, yes.
Okay, can I probably ask her 1 or 2 questions?
Oh, Lee, go ahead.
Okay. Okay. Lee, good afternoon, good morning or good afternoon. As an integrated oncologist, I want to find out what somebody can do when you have fog brain, that's chemo brain, as an aftermath of chemotherapy treatment. I have it, and I'm sure 1 or 2 other people probably should have it. So what do we do in that regard?
That is a great question about chemo brain. I have lots of information I can send to Ronsi, and Ronsi can distribute to the group some information and tips and ideas to help with the chemo brain, the cognitive dysfunction. I will do that.
Okay, thank you very much.
Okay.
Yeah. So, Hadiza.
Yes, Ronsi.
Yeah, we actually had many people from Medicaid that joined, though.
Yeah.
Yeah, that's really impressive. Well done.
Welcome.
Yeah. And just to let
I was
everyone...
hoping to hear your Oyibo accent, but you're just still Naija.
Please to change.
Uche accent. In a local man now, you send local man come Yankee.
What do you eat, Ronsi? They say about chops.
Yes.
What's the question?
How did I put this soup on Facebook?
Hi. Oh my God.
What? I see. I see.
I still they cook my jollof rice. So they eat swallow here with the goosey soup. I can't kill myself, Joe.
Thank you yourself. Thank you so much for this.